all the members of Samprabha. Welcome to one more edition, a very important and useful and informative edition of Sambhashane of 15th May. And today we are very, very happy and privileged to invite Dr. S.P. Yoganna, head of the Suyog Hospitals and Research Center, Mysuru, who is a
the problems of heart, even in youngsters, newborns, children's. When I was a practitioner about 20 years back, the the children used to bring their parents for cardiac diseases. Today it is just reverse. The parents, the old parents brings their children for cardiac problems. That is a transformation which has occurred in the evolution of cardiac diseases over a period of 2 decades, 2 to 3 decades. So therefore, this is because the people have understood our craze and are running behind about materialistic wealth. They have failed to understand the wealth of their health. Most importantly, the prime life keeper of the body, the heart. So therefore, today I am sure this session will throw some light on the structure of the heart, the function of the heart, what are the diseases that can affect the heart, and how to protect the heart of each individual. When I speak about the heart, Mr. Vasudevan made a remark about the other aspect of the heart. So I always say in my many talks, even when I was a teacher, there are two types of heart. One is a structural heart, another is an emotional heart. The structural heart is a what doctors say. An emotional heart is what a poet and an individual himself feels. And the structural heart and the emotional hearts are very much linked to one another. So therefore, the heart is also recognized philosophically and emotionally and identified with the feelings because all the emotions, either positive or negative, will affect the heart. What are all the problems you have with the heart is due, most of them are due to disturbed emotions. Today, either in the family or in the individual or in the country, or as a mankind as a whole, the emotions of an individual are being disturbed. The positive emotions are receding. Negative emotions of a human being are overtaking the positive emotions. That is the root cause of all these problems the society is facing, so also the heart. See, before going to the how to protect our heart, we should know what is the heart, what is the structure of the heart, where it is. As you all know, the heart is a very important vital organ which keeps the body alive by pumping the nutrient and the oxygen to all the parts of the body, to each cell of the body, and also collects all the dirty materials, dirty toxic materials which are produced inside the cells to wash it out to the outside, to throw them outside the body, either through lungs or through respiration or through perspiration. So therefore, the heart is a cone-shaped, very soft structure weighing about 350 to 500 grams, depending upon the weight, age, sex. The size of the heart differs, and it is rightly said the fist of that individual, the size of the heart corresponds to the fist of that individual. So that is the size. It is a cone-shaped structure with the tip down and base up. The structure and function of a heart can be compared to a pump set, which is used by our farmers. So the pump in a pump set, the motor is the heart, and the fluid, water, is the blood, and the tubing system is the blood vessels. So the heart, which is a four-chambered structure, made up of a highly specialized smooth muscle which is divided into four chambers. On the left side, you have two chambers. When you put the first Picture, sir. First picture.
Yes, sir, I shall.
First picture. Is it visible? First picture, is it visible?
Yes, sir.
Yes. See, if you see this, the right side of me is the picture of the heart when you see it from outside, which is on the left upper part of the chest. On the left side, in the upper part of the chest, it is like this, placed in the chest, inside the chest. The outside looks like this. If you cut it vertically and see inside, it is a four-chamber structure, upper two chamber and lower two chamber. Each upper two chamber and upper two chambers are called atria. The lower two chamber are called ventricles. The upper two chambers are again divided into by a wall into left and right. So also the lower chamber is divided into left and right by a wall called intraventricular septum. The upper part of the heart and the lower part of the heart, at the joining of these each chamber, there is a valve. It's called valves. These valves are a highly specialized structure which will direct the blood to flow in a unidirection, not bidirection. See, if you see, usually the left side of the heart receives the pure blood. The right side receives the impure blood. And the impure blood also, what is this impure blood? I told the blood can be compared to a water in a pump set system. This blood, which is very important, and it circulates in the system. And in a normal adult, there will be about 5 liters of blood. These 5 liters circulates in the tubular system and the heart. And this blood undergoes impurity and it gets purified in the lungs. How this does work? The tube system, that means the blood vessels, we have the pure blood vessels carrying the pure blood, and we have blood vessels, separate blood vessel carrying the impure blood. Pure blood means which carries the oxygen. So this pure blood is called arterial system. We call it as a arterial system. This arterial system, the starting point of the arterial system is what you are seeing, the red big one, the curved one is aorta. It is a very big tube. From that, from the lower chamber, that's called left ventricle, this aorta rises up and it comes down and divides, and by its all branches, it supplies the blood to each cell of the body, which is oxygenated blood, pure blood, and also the food particles. So from the terminal end of the arteriole, from the last branch of the artery, the impure blood system arises. This we call it as venous system. This impure blood system, which is also attached to each cell, it absorbs all impurities from the cell. So cell is a bioengine. It is a bioengine. It is a biochemical factory. It undergoes lot of chemical reaction to keep the cell alive. Lot of chemical reactions occurs to keep the cell alive. Our life is the outcome of millions and millions of chemical reactions that are going on in each cell of the body. So when these factory works, the biofactory works, so many so many toxic substances, bad substances are produced like carbon dioxide, urea, creatinine, and like so and so. And these are absorbed into the venous system, that means the impure blood vessels, and they are carried through the uh, impure blood vessel system, that is venous system, into the right upper part of the heart. We call it as atria here, and from this atria, the blood flows through these downward to the valve. It's called mitral valve, and from this right part of the heart, we call it as right ventricle. Yeah, and another tube arises, that's called pulmonary artery, and this blue one. The blue ones are impure blood. The red ones are pure blood, and this carries pulmonary artery to the lungs. In the lungs, it is purified because from respiration, the oxygen comes inside, and this oxygen is mixes with the impure blood in the lungs, and this impure blood and carbon dioxide from the impure blood is given out to the lungs, which comes out to the environment, and gets purified. Again, it comes to the left upper part of the heart, that is left atria, and then to the down to the left ventricle, and again to the aorta. And this is a continuous process which keeps the blood circulating. This is called cardiovascular system. That means heart is in the middle. On one side is the pure blood vessels carrying the pure blood, and another side is the impure system which carries the impure blood into the heart. Then it is sent to lungs, purified, then again comes to the left side of the heart. This goes on till an individual's alive. Remember, once the conception, ovum and sperm joins after an intercourse, the zygote is formed, the bruna is formed, and the zygote go on dividing, and the human body is going to be formed by this. By fourth, the heart is also formed, but the beating of the heart starts at the fourth week. Till fourth week, the fetal heart will not start, though it is alive. That is, it said, when that it starts, when the Atma gets incorporated into the heart, then it starts beating. This is the most important aspect, the spiritual aspect of the heart function. So these energy, this electrical energy, when it gets implanted into the heart at fourth week, then only heart starts beating. So once from the fourth week of the intrauterine life of the pregnant woman till the individual dies, there is no rest to the heart. Starts go on beating and beating and beating. And per day, if you calculate, the adult hearts beats about 1 lakh time per day. 1 lakh per time. If you want to count 1 lakh, how many minutes, how many hours you take, you please remember. So why I am telling all these things? It is one function of the body, one part of the body, which is specially designed, uniquely designed by the Creator to work 24/7 without rest. Without rest. Do you want to neglect such an organ in the body which works, keeps you alive throughout your life? 24 bar 7. You sleep, heart will not sleep. You relax, heart will not relax. So therefore, that reminds you what an amount of importance one should give to care the heart. It cares for you lifelong, not taking rest. But what importance you are giving for us is $1 million question. See, what does a heart needs? What is the care one should give to the heart? See, the Creator has designed this mysterious structure in such an ununderstandable way. We are unable to understand even till today how this heart functions. Though some mechanisms have been understood, some other mechanisms are not being understood. The human body itself is not understood completely by even so-called modern medicine. Completely is not understood. So also the heart. So the heart, the Creator has given it such a unique energy or unique, what I should say, unique, it has given a unique intelligence for the heart, wherein the heart can take rest while working. See, what is an important thing? So while working, constantly working, there is a methodology designed by the Creator to the heart where it can take rest even while working. That's why we advocate for our human beings. While working also, there are methodology to take rest, to avoid physical tension and mental tension as that of the heart. So what does the Creator has given? Heart works in two important stages. One is systole, technically, otherwise called as contraction of the heart. Another is diastole, relaxation of the heart. So, in diastole means heart dilates. Heart dilates. It is also the work of the heart dilates. When it dilates, it receives the blood. As when you fill up an air to the balloon, like that, the heart expands when it receives the blood. When it contracts, it pumps the blood outside its chamber. While relaxing, it takes the rest. While relaxing, diastole, it takes some amount of rest. Of course, while contracting, the powerful contraction of the muscle of the heart is called myocardium. A single muscle, the whole heart is made by a single musculature divided into 4 chambers. So systole and diastole is a very important activities of the heart. Systole means dilates, receives the blood, and diastole, during systole, it pumps the blood. This is one important thing. The heart beats 72 per minute. Again, it depends upon the age, then weight of the person, mental status of the person, emotion. I will come to that later. So, the heartbeat, with each heartbeat, about 70 ml of blood is pumped into the artery. Pure blood is pumped. About 70 ml from each beat, 70 ml blood is pumped into this. See, this heart, which is working so hard, also needs energy. See, one mysterious thing, one paradox thing that one should understand here, though heart is flooded with blood, it is embedded in the blood, it floats in the blood. Of course, right side is impure blood, left side is pure blood. So left side, even left side heart, though it has got a pure blood, it cannot as it is absorb the blood and get the nutrient. So just like that, you have a all raw materials, a food items in your container, but you may have to take it out through another mechanism and eat it. You cannot just like suck like that. The blood supply to the heart is also through a separate blood vessels, arterial system, and separate venous system for the impure blood. So let us know about the arterial system supplying the blood to the heart. This is very, very important in the background of heart disease. See, you see, in the heart, there's a vessel going round, a tube-like structure, you see. The red things are arteries, pure blood carrying vessels. The blue things are impure carrying. These are very important. They are called coronary arteries. They are named as coronary arteries. These are the arteries which arises from aorta, this great vessel, this big vessel which takes origin from the left ventricle. From the root of that, they arise. And they arise, and their branches, they supply the heart. There are three major vessels, arteries of the heart. Coronary, they are called coronary arteries because the major killing of the individual, one of the major diseases of the heart is coronary artery disease, wherein you get heart attack. So therefore, let us understand these arteries very well. If you understand these arteries very well, then you will further understand how can we prevent it. These arteries, there are three major arteries of the heart. One is left coronary artery, which divides the next one. Next slide, please. So this is what the blood circulation. This blood circulation, which I explained to you, you see, this is a diagrammatic representation. So this entire, uh, there is no part of the human being which has no blood supply, because without blood supply, no part can live. So therefore, this is a diagram. This is the blood vessels showing different parts, and this is diagrammatic representation of how it was. So next slide, sir. Now this is what I am speaking of, coronary arteries. This is the artery supplying blood to the heart muscle, four-chambered heart muscle. So these arteries, there are three arteries. This is left coronary artery and this is right coronary artery. Left coronary artery is a very important artery because it supplies the major portion of the heart and it supplies the left ventricle. See, if you study the work done by each part of the heart, left side is more works under more pressure than the right. So if you study the hemodynamics of the heart, left side of the heart works with more pressure, with more strength than the right side. So that's why we see the the blood supply to the left side of the heart is much more very important. For each part is very important, but left side is much more important because it works more, it works under more pressure than the right side of the heart. So the left coronary artery, this one, which divides into two branches. One is left circumflex and left anterior descending. So, and these two vessels plus right, so three vessels. So we call it as heart is supplied by three vessels. One is left coronary artery and its two branches, and the right coronary artery. This is a very important understanding of the anatomy of the blood vessels of the heart, coronary arteries, to understand a very important, a dominating heart disease, heart attack, which is due to coronary artery disease. So, how this heart beats is another important question. Heart beats, I told you, from fourth week of the intrauterine life, the beat has started. So this beats by an electrical energy which is implanted, electrical energy that we call it as Atma in a spiritual language. That Atma which was implanted in the form of electrical energy, which that is the energy which controls the beating of the heart. So there is one part in the heart where this electrical energy is situated. This electrical energy controls the functioning of the heart. From this electrical energy, which is responsible for pumping of the for the blood to flow, this electrical energy is disseminated to the other parts of the cell. So that is why in a spiritual health, when we analyze the heart, the SA node, which is an important part where this electrical energy is situated in a modern language, cardiac language, is the seat of Atma. Just the different thing. So the heart works by an electrical energy which is implanted to it at the fourth week of the intrauterine life, and which is carried throughout life. So when this electrical energy stops, then life will go. That's what happens in cardiac arrest. When there's a cardiac arrest, this electrical energy generation in the heart will stop. So this is called cardiac arrest, sudden death. That's what happens when the patient dies, due to any cause. So this is about, with this understanding of the anatomy and physiology, how to keep and how to the diseases at large. Before understanding, before going to the diseases of the heart, what are the factors which will keep the heart healthy? Remember, there is no medicine which keeps heart healthy. There is no medicine which can keep your heart healthy. See, what all the medicine we give, they only try to correct the derangement that you have invited. The heart can be kept healthy only by lifestyle. Nothing other than. Only by life. It is your lifestyle which keeps your heart healthy. What are the lifestyle measures? Please remember, it is working for you 24/7. You should care for it. I should care for my heart. That should be the slogan in your mind. What is the thing? What you should do? What is the lifestyle measure you should follow every day? The most important is the heart. You know, the Creator has given so many capacity to the heart. But remember, in a normal individual, only 25% is is exploited. It's only 25% is exploited. Even the brain function in a normal individual, only 25 to 30% is exploited. So also in the heart. So exercise is a very important thing, which will keep your heart healthy. Your heart healthy. Daily exercise of minimum 3 kilometers per day will keep your heart healthy. The sedentary life, that means working by sitting, will kill your heart. Sedentary life kills. Exercise will increase your cardiac reserve as well. Then the diet is very important. You should take a balanced diet. In this balanced diet, the most important is fat. Fat and carbohydrates. Fat, the individual needs cholesterol. Body needs cholesterol, about 10 to 15 milligrams cholesterol every day, because cholesterol, that means fat, is required for synthesis of so many vital chemical substances in our body, including hormones. Some people say, don't eat cholesterol, don't eat fat. No, that is the wrong advice. You have to eat fat. In what quantity is very, very important. You have to eat carbohydrates. Carbohydrates means these rice, ragi, wheat, sweet, sugar, they all come under carbohydrate. So these carbohydrates, they give energy. Yes, they should be taken in a required quantity. When you take more carbohydrate in the body, they are converted into fat and stored. So therefore, you should restrict. Balanced food means how much of energy, how much of fat, how much of carbohydrate you need. See, when you care for your vehicle, you think 100 times before going to a petrol bunk, how much mileage I am going, how much petrol it consumes, and shall I go to a good petrol bunk? Is it a good petrol? Is it an adulterated petrol? Are you thinking the same for your bio engine? No. This is the most important paradox the man has not understood his own body. So therefore, food is a petrol to your body. It's a bio engine. Please modulate your food. Balanced diet is most important. Then the habits. Smoking is the worst habit which you can never tolerate, never entertain. The smoking nicotine is the greatest killer of the heart. It's the greatest killer of the heart. So you please avoid smoking. Alcohol in a moderate quantity. That means 30 to 60 ml per week is moderate. Please remember, not 3 packs, 4 packs daily. 30 to 60 ml once in a week is a moderate called a moderate alcohol, may be good for the heart, but more than that is bad for the heart. It increases the cholesterol and it damages the heart. Another most important thing is happiness. Happiness. Heart is connected to emotion, emotional heart. That means all your emotions will affect the functioning of the heart. Because mind, as you all know, mind exists in thoughts and emotions. Emotions are very, very important. Positive emotions, I don't know why the creator gave negative emotions also. That the greatest tragedy done by the creator to this human being. No doubt he gave a very excellent brain, excellent intelligence. At the same time, he ruined us by giving negative emotions. If he would not have given negative emotions, he would have been very always in the state of happiness. What is positive emotion? Love, confidence, cooperation, all are positive emotions. See, when there's a positive emotions, interiorly, they are positive, they are happy hormone, you are happy. When you are positive emotions, there will be a positive energy. And endorphins are liberated. Dopamine, serotonin, they are all called happy hormones. They are liberated. They are very good for the heart. They strengthen the heart. They keep the heart in a normal function. Negative emotions, unhappy, jealousy, non-cooperation, hatredness, all are negative emotions. They give rise to unhappy hormones, adrenaline, noradrenaline, corticosteroid. They kill the heart. All will raise the blood pressure. So therefore, this is each emotion you raise in your mind has a positive or a negative impact on your brain. Some people will come to me and say, Sir, I don't smoke, I don't drink, I don't have a cholesterol in my body, everything is all right, but still I had a heart attack, massive heart attack. If you analyze the history, he is always under the influence of negative emotions. Negative emotions, you may not have any diseases, forget. If your mind is not happy, if you are not comfortable in your working place, in your home, in the road, the state of happiness is very, very important. The purpose of life is to be happy. And what all you do, whether good or bad, is to get happiness. Some people get happiness by doing bad things only, but it is only temporary. If you are not happy, you cannot keep others happy. So therefore, emotions plays a very important. When negative emotions are there, the heart is controlled by autonomic nervous system. A separate a separate designated nervous system creator is given to control the heart. When this is called sympathetic and parasympathetic. When these negative emotions overtake, the the sympathetic nervous system is overexcited. Your heart gets go on beating and beating. Your blood pressure rises. More workload on the heart. This is the one. So therefore, emotions. 4 to 6 hours of sleep is very much essential to keep your heart healthy. And spiritual thoughts, spiritual lifestyle. What is spiritual lifestyle? Spiritual lifestyle is not worshipping God. It's not religion. The religions are killing the man. We are seeing now. The religions are man-made. Somebody wrote in his book, kill everybody who doesn't agree with you. What nonsense this. And people are following that. Killing another human being, hating another human being. If you call that that is not spirituality. The religions which are man-made have incriminated negative emotions by these preachers, and mankind is divided depending upon the region, depending upon the caste. One region, one caste is fighting on the other for its superiority, forgetting that everybody is going to say goodbye one day, and all these things is going to ruin your heart. So this is how, again I repeat, only the lifestyle, only the healthy lifestyle. What is spiritual lifestyle means? It is such a lifestyle which keeps you happy and connects you with the nature and showing gratitude to the Creator and keeping your surrounding happy. This is spiritual lifestyle. You must evolve a lifestyle wherein you keep yourself happy, keep everybody surrounding you happy, which indirectly keeps you also happy, ultimately surrendering to the highest transcendental power which is controlling the entire universe with highest gratitude to it. This is spiritual lifestyle, which is very good for the heart. Lastly, what are the diseases which can affect the heart? If you follow the spiritual lifestyle, no diseases. What are the common diseases which can affect the heart? One is congenital heart diseases. Unlucky people are born by birth with some diseases. The heart is not structured in a way it should have been. By birth itself, there is some problem. Let us not bother about that. The second is the rheumatic heart diseases. It is not common in India, no, wherein because of the infection, throat infection, and throat infection will go to the liver and damage the liver. That is rheumatic heart diseases. That is also in India, we have effectively controlled now. That is not a threat. And congenital heart diseases, that is also being controlled because of the prenatal, antenatal care we are taking for a pregnant woman. They are also coming down. So rheumatic heart disease, because of the advent of penicillin and all, that's also being very well controlled throughout the world, more so in India. And the next is ischemic heart disease. This is coronary artery disease. This is the one which is threatening the mankind around the world and around this. Why this is happening? This is because of coronary artery disease, blockade of coronary artery disease. The next slide, please. Next slide, please. Yes. You please see what is blockade of coronary. I told you that there are three important vessels in the heart which supplies the heart. See, you see this way, this play coronary artery. This is the vessel, coronary artery supplying the heart. The lipid, the cholesterol goes on depositing here. The coronary arteries are very thinner arteries, very small caliber. So if the cholesterol go on depositing, so next slide, this one, please see it. This is a very important thing. This is the point where that square is the point of block, and this is an enlarged point figure of inside blocking. You see, this is the deposition of the cholesterol, and this cholesterol blocks it. So when the cholesterol is blocked, the flow of blood in the inside the vessels gets blocked. So the heart muscle, which is working throughout the day, doesn't receive this quota of oxygen and quota of nutrient. So that particular part of the blocked blood vessel, that particular part of the portion of the heart, muscle of the heart, which is receiving the blood supply from that blocked, it will not receive, it will die. That is called myocardial infarction, heart attack. So why do you get this blockade? As I told you, this blockade is due to increased cholesterol deposition. And this increased cholesterol can also occur because of unhappiness hormone, which I have told you. When your happiness hormones are more in you, even if you smoke, even if you drink, it will not produce any heart attack. This is the study given. So therefore, it is not only cholesterol, All these factors which I have discussed, the lifestyle measures, food, exercise, sedentary lifestyle, mental tension, smoking, alcohol, and body weight. Very important, very, very important. Remember, if your body weight, body muscle index, that means it is the ratio of your height and weight. So the height and weight ratio is more than 25, more than 35, you call it the obesity. So this obesity, whenever there is a obesity, remember, 1 pound of increase of body weight will add 1500 kilometers of blood vessel. Please remember. So another mysterious things, if you join all your blood vessels and make a straight line, it will go around the globe, around the globe. That's why it is said, man is the miniature of the universe. So already there is so much of blood vessel in the body against which heart has to work. So addition of 1 pound will increase additional 1.5 kilometers of blood vessels. So extra strain on the heart occurs. So that's one. Second, obesity produces a hormone called leptin, which causes diabetes. Again, another precipitating factor, another aggravating factor of coronary artery disease. So increasing diabetes is also one of the cause of this coronary artery disease. So, and blood pressure, in diabetes, when there's a diabetes, uncontrolled diabetes, it increases your cholesterol. And diabetes means there is no glucose to the heart muscle. So heart muscle gets damaged. So diabetes, uncontrolled diabetes also increases cholesterol. So remember, cholesterol you can take either from the food. Even if you don't take in the food more cholesterol, the body itself synthesizes cholesterol in people who have a genetic defect. And in people who are mentally tensed, the body itself produces cholesterol. This is one other bad thing. And if you have uncontrolled diabetes, the body itself produces more cholesterol. So therefore, this is the another thing. So this is a common heart disease today is coronary heart disease, which leads on to a heart attack. And of course, there are other diseases, infective heart diseases. If you have typhoid, if you have viral fever, that also can affect heart. And if your blood is less anemia, that also can affect heart. And if you have a serious respiratory disease, a smoker, chronic smoker, his lungs gets damaged. Ultimately, that also involves the heart. Ultimately, all diseases in their terminal stages affects the heart. They are not very important for us. Nowadays, our problem is coronary artery disease. Youngsters are getting coronary artery disease, heart attack, because of their lifestyle changes. And the today the modern man is competitive. You want to increase your GDP. You want to increase your tax collection. You want to increase your bank account. And you work on target. Please remember, the Creator has not given this body to work on target. Target is not an expectation of your heart. While designing this body, you design some computer for some work. You give a design some, but you have created, designed this body for what purpose? Not for target purpose. The purpose is you are born, be healthy, be comfortable, be happy, procreate to continue your race, and you go. Collect GST, 1000 crores, 2000 crores, put GST and all. I'm very sorry. For membership of an organization, I have to pay GST. To get a membership in a social organization, you please take it up this issue. Because of GST, our doctors are getting heart attack, do you know? Because the reason is people have lost confidence in the public sector hospital. They have got confidence in the private sector hospital, but private sector hospital treatment has become very costly. Government is not supporting. People will come to us. The Indian people are not capable, though our medical system is very cheaper than Western, but our paying capacity of our people is very less. Government doesn't support any private healthcare industry. The cost of private healthcare industry is very enormous. So we work under pressure. There are more heart attacks in youngsters. They work on target. Doctors are also given target in private hospitals. You know, it's not a open, it is not a secret. We are getting, even cardiologists are getting heart attacks. Their physical health is wealth. And because of this target, please remember, the whole our lifestyle has to change. The increase, not only heart attack, the mental diseases are increasing, the families are breaking. So whole our ancient Indian cultured society was peaceful, even though they were not educated, even though they did not have what are all the materialistic benefits now we have. So therefore, please remember, all these things are outcome of the change in the lifestyle on a targeted basis. Unless we change our lifestyle, overall health will never improve. Overall health will not. We have to go back to Thailand. Bhutan. Please, please see Bhutan. Bhutan is the most happiest country. No diseases there. Let the government go and study. There is no GDP there. There is happy index there. They assess the progress of the country not by GDP. What is GDP? How did you sell? How much sand you sell? How much brick you sell? How many people in your country are happy? That is the happiness index. That should have been the criteria for the you go to Bhutan. That is the happiest index criteria they take. They are very happy that country. So therefore, friends, I conclude the heart is a very important organ. There is no disease. There is no drug which can keep you, which can increase, which can protect the healthiness of the heart rather than spiritual lifestyle. Thank you, one and all.
Thank you, Doctor. It is a really very engrossing kind of a session. And you have reiterated again and again what are the basic requirements to keep your heart healthy. And you have presented it very beautifully and very effectively. We are very thankful to you for taking up this session. It's more of a sensitizing the people. Once if they are sensitized, once they are conscious, I think we will be able to maintain a good health. So I'm sure all of us must be having a lot of questions. I want to ask you, there was a lot of discussion when Punit Rajkumar passed away. It was a sudden thing, but there were doctors commenting that it should have been detectable. It's not that any of these things will happen suddenly. Can you please explain that what is the cause for?
One thing is silent myocardial ischemia. There is one condition, silent myocardial ischemia. That means there will not be any symptoms. The disease, see, as I told you, this electrical activity of the heart will suddenly stop. So the coronary arteries, the blockade of the coronary arteries, that 20%, 30%, 40% will be there. Right? That ulcer I showed, about when the heart stops completely, when the major vessel is blocked. The major vessel here is left coronary artery. So left coronary, supposing if it is 30% blocked, you will not have any disease. The 30% blocked one, if you smoke, if you are under tension, that becomes an ulcer. During that, at that point of ulcer, the blood clots. So suddenly there is a blockade. So sudden death will happen. So what might have happened in Puneet is this. And sometimes there will be electrical instability. The cause of it is not electric. There is sudden stoppage of electricity. We call it as ventricular fibrillation. That comes in individuals which are highly tensed up and extraneous exercise. So I told our body is not made for extraneous exercise, extraneous running. Please remember, even extraneous exercise will cause the heart vessels to collapse, shrink. So, but that happens when you are making an exercise, especially gym. Not that
So
you should
that
not.
means you have to be moderate in everything.
You should be moderate. Should be moderate in everything, and you have to undergo weekly, monthly, or 6 monthly checkups. See, remember, the coronary artery disease is a genetic disorder. Unless there is a genetic predisposition, there must be a genetic predisposition. Then only you will have it. These are precipitating factors. They become aggravated in a genetically predisposed. Say Rajkumar had heart problem. I was also very well known to him. For a few days, I was also his physician because his wife is from my place, Saligram. So, and all his family members has coronary artery disease. So in those patients, in a patient where in a family where there is a history of heart attacks, history of coronary disease, they should undergo periodic checkups, and all these precipitating factors should be controlled, well controlled. And definitely, see, heart attack is a preventable thing. It is one of the most preventable thing at the same time. Preventable. If you detect early, if you do a stenting or if you remove that block, it's a preventable thing. So frequent checkup in people who are history of family history of heart attack, in a diabetic patient, in a obese patient, and in a high blood pressure patient, you can definitely prevent this disease.
Vijay
Doctor,
Kumar, you want to ask some questions?
sir, I want to ask one question, sir.
You tell me, sir.
Sir, whenever we go to hospital with some condition like this, so some heart condition, so which requires some immediate medical attention. So doctors generally what they do is they say go for angiogram. After that angiogram is over, they say some block is there, we have to put stent. So we don't know what quality of stunts they are going to put. They say there are two types of stunts. One is Indian and one is foreign. Foreign is expensive and Indian is inexpensive. And after that angioplasty is over, we cannot know what has happened. So is it how to know whether it is a genuine case of requirement of angioplasty, sir?
Yes. See, there are indications.
Yes.
When an angioplasty, supposing if there is a 20% block, if there is less than 50% block.
Yes.
So this we decide whether he needs stenting, angioplasty, whether is a by what type of treatment is required is decided by the type of block, the artery which has been blocked, the number of blocks, age of the patient, affordability of the patient. These are the 5 factors which usually an ethical doctor thinks.
Yes, sir.
Ethical doctor. So when the block is less than 50%, anywhere, even in a major disease, it's a medical treatment. Medical treatment. So we give medical treatment to reduce the block and to prevent the further progression of the block. If there's a 50% block, the blood is still flowing, and the 50% is there to flow. So you don't need any treatment except one caution for such individual is you should control all risk factors. Your body weight, if you are diabetic, perfect control. If you are hypercholesterol is more, you have to you have to control your cholesterol. If you are a smoker, you should control your smoking. If you have got any, if you are unhappy always, reduce your state of unhappiness. If you cannot completely eradicate, reduce it. So this should be a constant one, control. And periodic checkup, once in 6 months. Right?
Yes.
Then, if it is more than 50%, 60%, 70%, in a major vessel, I told left coronary artery is the major, just like the main water supply to your house is coming, that is blocked. Suppose one of the pipe coming to your room is blocked, no problem. You can go to some other room and take your bath. If the sanitary supply coming to your house at the road level is blocked, then it has
Yes,
to be clear, is it not? So
Yes,
like
sir.
that, the left coronary artery is blocked.
Yes, sir.
If it is more than 60, 70, a stenting is a must. What
Yes,
we do in stenting, you remove that block. That block is just, it is removed, and some tube is kept. Some tube is kept. Let's go. Stent is a tube-like structure which contains some chemicals which will prevent, which go on slowly releases some medicine which will prevent further block. That is stent. Suppose
Doctor,
if there are multiple stent, multiple blocks, then multiple stenting we will not do. If you are fit for surgery, a new blood vessel will be a new blood vessel pathway. A new blood vessel is taken from your body. If a blocked artery, some bypass is done by stitching a new vessel. And this new vessel will definitely will not clot for at least 10 years. And this can also clot if you continue, if you don't mend your lifestyle.
doctor,
And
Thank you,
you
doctor.
said,
Thank
doctor will go for angiogram. See,
Yes.
what happens if your patient is a diabetic, right? His ECG is normal, his TMT is normal, echo is normal, but still the patient continues to, and he's a diabetic, he's an obese individual, family history, his father has died of an heart attack, family history is there. In these situations, we don't want, and he is not responding to oral treatment. So this condition, see, one thing is, one dictum is there in medical profession. You should always think of a life-saving, life-threatening disease. You should not ignore a life-threatening disease. So therefore, in certain and those conditions, because of diabetes, because of hypertension, because of your weight, because of your cholesterol, if these factors are there, you have a chest pain or palpitation, or when you walk for some time, you get breathlessness. These are symptoms of heart disease. And they are not responding to the medical line of treatment, even though ECG is normal, echo is normal. So I will go extreme step to say, let me do an angiogram. Because in 10% of the cases, still there could be a significant block, and all these other examinations will be normal. So therefore, the doctor will advise an angiogram under those circumstances.
Thank you. Thank you, doctor.
Doctors, sorry to intervene. Troponin ಬಗ್ಗೆ ಒಂದು 2 minutes. Troponin, how the troponin level is affecting the heart
The
health?
troponin, when there is an infarction, and that means because of the block, a portion of the muscle is dead, cardiac muscle is dead, right? That muscle, inside the muscle, there will be a chemical substance called troponin 1. When the dead cardiac muscle is dead, from that dead muscle, the troponin comes out of that cell, cardiac cell, and it comes to the blood. So the quantity of this will rise in the blood. So this is a very sensitive indicator of a recent myocardial infarction.
Exactly.
Within
That.
4 hours. Within
Yes,
4
within.
hours.
Yes, yes, doctor.
So lack of sleep is one of the reasons for troponin, continuous lack of sleep over a period of time. Does it
Very
increase?
rare, very rarely, it can increase in certain individuals, even though they don't have an heart attack. In those individuals. Very rare.
Okay, doctor.
Doctor, there is a question here. Have doubt, sir. Does the plaque already formed in the coronary artery can be dissolved, reduced through daily exercise? It's being asked. It's Mohan Reddy. He has asked this question. Does the plaque already formed can be dissolved or reduced?
See, 90% of the middle-aged and old age people will have plaques. The greatest liar is one who presumes that he has no plaque at all. Plaque will be there in all individuals. Presence of a plaque is not a disease at all. It's a part and parcel of a natural coronary artery. Plaques will be there. But how much? To what extent? In how many vessels? Is the question. So, there are some studies. The plaques have dissolved. The plaques have dissolved not only by exercise, all lifestyle changes. See, if we do exercise, go and smoke, the smoking will not give a protection to the benefit of exercise. It should be holistic. Please remember. Some people say, every day I do walk. Yes, very good, Baba. What you will do in the evening? 4 packs I drink. 1 pack. What you have walked in the morning will not protect you. But the bad effects of drinks and smoking you do in the evening. It should be a holistic approach.
There is one more question, sir. Should we keep aspirin satin packets always?
I think better in a predisposed individual. See, predisposed individual means you are a known cardiac patient, you are a known diabetic patient, a known cholesterol patient. Nothing wrong if you keep on the aspirin 300 milligram and 2 tablets of atorvastatin 80 milligram atorvastatin in your packet. Because in a heart attack, how early you treat is the one which determines further complication and your survival. So therefore, when you, it is good to keep these tablets at home, always in your packet. When you get too much of pain, sweating, symptoms of it. If you take this, no bad effects will be produced, then go to a doctor so that you are preventing the most dreaded complications. No problem, we can do it.
There is last question, I think here. What is mitral valve leakage? Mitral or mitral, I don't know. What is the treatment?
Mitral valve leakage. Mitral valve leakage. Can you put me the first slide?
First slide. Yes, sir, I shall.
First slide. Because with figure we can understand better this question. No, first.
I'm going.
First.
Yeah.
Yes. See, between the upper chamber and the lower chamber, there's a valve. Understand? This is our valve. Are you saying this is our valve? Mitral valve means the valve which is there in the left upper chamber and left lower chamber. This is called mitral valve. Understand? So what this valve will do, this will direct the blood flow downward. It will prevent the blood flow upward. You understand? This is the function of this valve. In a mitral leakage, is reverse also will happen. So the blood from the lower chamber will leak to the upper chamber. This is mitral valve leakage.
Okay.
Vijay Kumar or Rigde?
Sir, good evening. For that.
The treatment depends upon the severity. If it is a very mild leakage, mild to moderate leakage, no problem. It will compatible with life. If it is a severe leakage, take out that mitral valve and put an artificial valve.
Oh, okay.
Mitral valve replacement.
Okay. How it is, sir?
See, now it has become very cheaper. I think it's about 4 to 5 lakhs it will cost if it is a good. So another question was asked. See, these the stent, foreign stent and local stent. I think you were asking. Somebody was asking about that.
Yes, sir.
See,
Rajnikant.
agree.
Yes, sir.
I agree. See, always the quality of stents are Indian stents are there, foreign stents are also there, but more or less all are good nowadays, right? All are good. All are good nowadays. They go. Most of them are all equal nowadays. And some people are fond of, just like some people are fond of foreign. If the foreign material they believe it is as good. Moneyed people. Probably doctor will tell for all these things for moneyed people, not for a middle class and poor man.
Thank you, doctor. Thank you.
Thank you very much.
And,
I
this
think
one,
Vijay Kumar has.
mitral valve, the
Sir,
mitral
good evening.
valve. One minute, this mitral valve also, there is a tissue mitral valve and non-tissue mitral valve. So tissue mitral valve all costly by 5 to 6 lakhs will be there. A non-tissue valve, which has got some problem after replacing, it will be 2 to 3 lakhs.
Good evening, doctor. This is Vijay Kumar from Chennai. I have a
Tell me,
small
sir.
doubt, doctor. Of
Tell me,
late,
sir.
we are very busy with the WhatsApp. There is so much information which is coming. How to identify which pain is serious pain? Because if you go through WhatsApp, it looks as if all the pains are serious only. How to identify which is
WhatsApp University is creating lot of
What problems?
Yes.
very much headache for the doctor.
now it is become very scary because every pain we are scared.
Google doctors and WhatsApp doctors are creating lot of problem for the doctors. I tell you, it's very difficult because see, medical science is not a perfect science. Please remember, there are so many atypical presentation. Even in textbooks, even diseases will not manifest in the same way. If the same disease, say COVID came, for many people, all people did not die, even without medicine. So some people died even with medicine. Why I am telling this is, it is a scientifically proven fact, even a disease will not manifest, same disease will manifest differently in different individuals. Though some common things will be there. So it is the doctor by his experience will decide a particular line of treatment. And even the line of treatment will also be multiple. So doctor always in his judgment will decide taking so many factors into consideration, all these things. So like that in WhatsApp, what we get, they may be true, maybe some atypical presentation. For him, it may be true, but that cannot be generalized. Because your mind is different, your soul is different, your parents are different, my parents are different, my gene is different, your gene is different. And the environment you live is different, the environment I live is different, what food you take is different, what is it not? You should individualize. Medical science is an individualized science. Though it can be generalized to some extent, everything cannot be generalized. So therefore, don't hear somebody's you personalize your symptoms.
Doctor, I just want to say one thing finally.
Yeah.
There is a small quote which says, there is no medicine like happiness, and there is no happiness in medicine.
That is 100% true. That's what I have been telling.
That's what doctor summed up today. And one more thing I want to say, doctor has been a very kind, polite, soft, patient. I think you are successful because of your patience.
True. True.
Sir has written many books. Some of them I have quoted. Today evening he was telling me about his book on science and Atma, how spirituality are talking to each other, and heart speaks the spiritual language. That's what he was telling. I am happy and eager to read that book. So he has done huge amount of study on both spirituality and science. And without spirituality, science is nowhere. That's what he always tells. You can listen to him on the number of videos which are available and very popular. And he is going to get it translated in English, which he has promised me that going to be released in a couple of months. We are looking forward for that book also, sir.
I think we should have one session on that itself from Dr. Yoganna, and is a very interesting. He explains very beautifully, as Vijay Kumar said.
Sir, 1 second, sir.
Thank you, Doctor.
Sir, my friend used to say, I am not alcoholic, but I am spiritual. Thank you,
Sir, shall we move to the last part of it? Rajinikanth, sir, can you take over?
Thank you.
Good evening. Yes, sir. Yes, sir. Thank you. Yes, Dr. S.P. Yoganna, sir. Today, you have not spoken as a doctor alone. You have spoken as a spiritual master also. Your talks were very enlightening. I can say in brackets, it is heartful. It is very good, very nice to hear. And you have put it in a very simple language. Just by showing the diagrams, you have taken us to anatomy classroom where you explained everything in detail. We are very grateful to you, sir. Thank you very much. And your treasure of knowledge. We feel like having you once again and much more times on our shows.
Thank you, sir.
Thank you very much.
And I thank all our listeners who have been very kind enough.
I thank all the participants. I thank the technical team. So I thank Ms. Kodandram for having this PR ability, and he is able to get us more and more people like this. So thank you, Kodandram. Thank you all participants.
Thank you, sir.
Special
Thank
thanks
you,
to
everyone.
Dr. S.P. Yoganna.
Thank you, doctor.
Thank you, sir.
Thank you, sir. Thank you,
Sukhino bhavantu.
Thank you, sir.
Thank you, sir.
Good night, sir.
Yogesh Gowda, sir.
Thank you, Doctor. Thank you, Kodandram.
Thank you, sir.
Rajinikanth, Vasu,
Thank you, sir.
Ashik, and all of you.
Good night, sir. Thank you.
Good night.
Thank you. Good night, sir. Good night, sir.
Good night.